What's up, y'all? Danny Matta here with PT Biz, and I'm in Boston. I'm here checking out a few of our clients' practices with my business partners, Eve Gigi and Jared Moon. We're gonna go see a few of our clients and show you what's going on in the performance clinical space, which we think is exploding all across the country. And we really wanted to be able to highlight that because you may not know what these practices are doing. You may not know what's possible with your own clinical skill set, and we want to be able to show you that. So stay tuned. We're gonna go check out some cool places and show off the city a little bit as well. What's up, everybody? Here in Boston, visiting Jeremy Dupont with Ripple, checking out his super cool space. We're in Back Bay, right? Boston.
Back Bay, Boston.
We got, what's the name of the park we just walked through?
The Public Gardens, Commons, we're on Wilson Street.
Second floor, right up here. Ripple Base Camp, you can see it up there. We're gonna go up there and check out a space. One of the best design spaces of anybody we worked with, and I'm super excited for him to show it off. All right, this is it, huh?
This is it. Welcome to the spot.
So, how big is this space?
So we've got just about 1,200 square feet here, which in Boston is a big spot.
I'm learning that.
Yeah.
The color branding, a couple things that I noticed, color branding, and then there's also interesting like lighting, as well as just like very Boston things, like a Pez dispenser, you know, is that Charlie Brown? Was
He's
that?
got socks hat on.
Yeah, socks hat on. So Ari, what were you thinking with this space and why you want to make it look this way? Because this is a very distinct waiting room in terms of, I've been in a lot of clinics, and this one looks very different than most of them.
Yeah, I think the book, Be Our Guest, had like huge influence. Really good book, but it was all about like experience of like, what this place is. And that's like part of our core values here. Like, we don't have patients, we have guests here, like everyone that's coming in. So that's like, you know, even as you guys were walking in, you're like, what does that smell? Like that's, but yeah, I think we have so many people that come in and are like, like they recognize the smell whenever they come in, and they like, you know, they know they're here, whether it's like they worked all day long and now they're actually like at PT, and like this is like a positive experience versus something else. So.
Versus a waiting room that no one wants to be in while they fill out 20 pages of paperwork and then you're 30 minutes late if you're lucky.
Exactly.
How'd you come up with the colors like this, like teal, blue, I guess is the way to describe it. Like
it was really cool. I went through one of my buddies, Adam Danielson, I'll give him a shout, took me through like his whole like branding process. And you know, we knew we wanted to lean into, you know, I had like a huge 90s influence. I grew up a sports kid in the 90s.
Oh dude, wait till we go to the back, because we'll see in a second.
Exactly, right. And this is a lot of the color scheme that was going on there. And I think where I've had a lot of success with patients in the past was, you know, because we work in such a corporate area, getting people to talk about the Mighty Ducks or the Grateful Dead, or like they go from their type 1, you know, type A job where they're super stressed all the time. Now they're talking about the Grateful Dead show that they went to 30 years ago. Like that's a whole other experience for them.
Right.
So we knew we wanted to be bold with our colors because this isn't a PT clinic.
Yeah.
So we landed on these colors, and yeah, it's been cool.
All right, cool, man. So like, this is the gym, right?
This is the gym. Yeah, so we used to have, it was a acupuncturist office before we moved in here. So there was a wall here that we had to knock down. Yeah. So we did a little bit of repair, but we got all the Rogue equipment. Really, it's because we're trying to like really emphasize the one-on-one side of treatment, right?
Yeah.
And you can't really any more than one person in here, one patient. So it's a perfect setup. So we try to, you know, if we're transitioning people into more of the training side of things.
But like, when you got started, what did your first space look like? Because you were like going to other people's houses, right?
Yeah, so it started in mobile, because I started during COVID.
Yeah.
So it was a lot of the mobile stuff. You know, I was bouncing around that park that we just walked through.
Really?
That's where I was setting up shop.
So you're treating people in the park?
Yep, treating people in the park. So I'd go from there, I'd see 3 or 4 people there. People loved it, to be honest with you. It was kind of great.
If I remember correctly, it was a super pleasant spring.
Yeah.
You know, like, I don't know, it was like the best spring to like be stuck at home.
Inside for, like, for stuck for the last 3 months. But yeah, it was a beautiful spring. Everyone wants to get outside. This is an excuse to get outside.
Yeah.
So, you know, it did its job for what it needed. So I started there, you know, rented some space out at, you know, similar size. There's like personal training studios you can rent by the hour.
Yeah.
I did that a little bit.
Like similar size to this gym space?
Yep. Yeah. And then I just knew like I knew I wanted, you know, the vision of this thing started to come, and moved into this space in January of 21. So,
I mean, like when we think about, the setup of this and like what you guys are doing, there's nothing in here that even says physical therapy.
Yeah.
And that's what I think is so interesting, because like even with us, we named our practice Athletes Potential. We're like, what is this? A gym? Is this a clinic? Is this it's just a vague name for something, right? Like what's a Ripple?
Yeah.
You know what I'm saying? Like, I mean, there's a reason behind it. But it's not like it comes off right away. People don't realize. So in a lot of ways, do you feel like the lack of defining physical therapy, has that helped you? Or do you feel like that's hurt you in some ways?
Yeah, I think both probably, right? Of like, especially at the beginning, it's like, what exactly does this place do?
Yeah.
But now like our brand is super established now, and it's pretty cool. Even like people will sit across the street at Tate, the coffee shop across the street, and they'll look up and they'll see Ripple, but then they'll see this mural right here too, and they're like, what is this place?
Yeah.
And so they'll we've had people comment of like, hey, you should put physical therapy on the stickers, or like sports massage, or whatever it is that you do. Like, no, I want people to go to the website and actually experience what we do. And
when I started my practice, I didn't think a damn thing about branding at all, right? Not at all. But I think it makes such a big difference in terms of what people feel when they come to your facility, but also your staff, and like them being a part of something that's unique. I think it's a great way to improve your culture. So
Jim Rice, Griffey,
Cal Ripken, let's go. Cal Ripken's the best, man. So, all right, tell me about this, because you and Jackson use the same designer, right? For the wall. So, like, what is the significance of this is like obviously somebody moving, right?
Yeah.
So like running
forward, runner moving forward. When I first moved in here, you can see even the drop ceiling still, there's not much you can do about that, but it was like yellow walls, disgusting, very depressing in here. So we knew we needed to brighten it up, and that's even just adding like the small lights in through there. We try to keep things as modular as possible too, and try to use the space as much as we can.
Tell me about these three posters, because I really like these. We talk about this sort of like in the mastermind, we talk about this 3-step process, constantly trying to convey what we do with people in a really, simple way, right? So for you, these are your 3, right?
Mm-hmm. Yeah, so we got kind of traditional stage 1, rejuvenate, which is more really at the point where a traditional PT clinic is going to discharge somebody. Right. So we're working with people, kind of past that 12-week mark really, and then expand is almost like a high-level strength training, high-level personal training session. So we map these out just so our patients can understand what their trajectory looks like, and what does this actually look like. So
this is the hangout area that you turn into another office.
Correct.
So at this point, it's 3 sort of treatment spaces, or like this is a flex gym space potentially, right?
Yeah.
So when you guys are pumping out people in terms of like your visits per month, what's like capacity in a space like this in terms of like how many sessions can your staff see like one-on-one in a month?
Yeah, so I think it's tricky. Like, we don't love having 4 people in here at a time.
Yeah, it's probably tight, huh?
It's tight, especially if you have 4 people waiting in the waiting room.
Oh, sure.
Plus 4 people in and out of there too. So we try to keep it at 3 people, and 4 people if we need to do it.
Yeah.
My staff has like a fairly flexible schedule where they can pick and kind of choose when and where they want to work, which I want them to have that flexibility, but it's got to be within the constraints of what the availability is here too. So most of our staff members see anywhere from 25 to 35 patients in a week, which is pretty average, pretty consistent for us, and that seems to work with capacity and how we work here.
Well, cool, man. Well, this was super fun. I really appreciate you showing us our space. Dude, this is it. Hey, if you're in Boston and you want to check out Ripple, Jeremy's place is awesome. We've really enjoyed getting a chance to highlight, your space, highlight Jackson's space, to see the city. We're gonna go grab some dinner, take Ian out to go get a better beer than Sam Adams.
No Sam Adams.
No Sam Adams allowed. Or get him one that's we'll get you like a hard cider or something instead, I'm sure. Like that. So, but anyway, hey, thanks so much, man. I really appreciate it, guys. I hope you like this. If you like it, let us know. This is something that we're trying to do more. I want to highlight some of the people we're working with. And really, it's performance-based clinics that are popping up everywhere, that are really making a huge impact in their clients' lives. And I think that's the coolest part, is these like mission-driven businesses where we get a chance to really help people get back to the things that they don't think they can do, or to do things for longer than they think they can do, and to be able to have a business that is a great business to own, is a profitable business to own, but also to be able to have like all these positive things that we help people with personally, not necessarily just monetarily, is just like what a win. So anyway, all right, man. Well, thanks so much. Appreciate it. Let's catch you guys next time.